Dr. Besser, always good to have you here. This new report in the Journal of American Medical Association revealing that Americans are dying at rates much higher than in other countries. Why is that?
Well, Stephanie, we've talked about this before, and when you look at countries that have been the most successful at controlling this, they followed the lead of public health. Public health has laid out the plan in terms of wearing masks and social distancing and hand washing, investigating cases, contact tracing, providing safe places for people to isolate and quarantine. That's the roadmap to not just saving lives, but also to opening the economy in a way that's sustainable. In the United States, what we've seen is this clash of messages where public health is united at the federal, state, and local level around those messages. But political leaders are giving very mixed messages. In some states, red and blue states, we see governors following the path of public health. But at the federal level, at the White House, we're hearing the pandemic being downplayed, nothing to worry about. When you have that kind of situation, it leads to people following guidance based on their politics rather than based on the science. And that's truly deadly.
Let's talk about that guidance from politics. Just this week, two senior White House officials referenced a document advocating for herd immunity. Can you talk about this as a strategy?
Wow. I mean, it's something called the Great Barrington Declaration. And herd immunity is an important concept in infectious diseases and in public health. And, as a pediatrician, I think about it with different infections. What it says is, if you can vaccinate a large percentage of the population, you will be able to protect those people in the population who are unable to get vaccinated. So, for instance, if you think about measles, not everyone can get the measles vaccine. Very, very young children under a year can't get vaccinated. People who have cancer or on chemotherapy can't be vaccinated. But if you can vaccinate 95% of the people in the community, they'll be protected because that virus is going to keep bumping into people who are vaccinated and won't get to those who are at risk. What this declaration is saying is that because young people are less likely to be hospitalized and to die, let's let them all get infected, and they can provide a buffer for older people. The problem with that, and there's a lot of problems with that, is when you look back to the summer and what we saw in Florida and Texas and Arizona with big increases in cases in young people, it didn't stay with young people. A couple weeks later, we saw rises in older people and people who have medical conditions. And not all young people do well with this. The rates are lower in terms of hospitalization and death, but they're not zero, and we don't know the long-term impact. The other aspect of this, Stephanie, and I think it's really important to call out, is that this approach is fundamentally racist and classist. Because as we've talked about, this pandemic, it hits all communities. But Black Americans, Latino Americans, Native Americans are being hospitalized and dying at much higher rates, lower income Americans as well. So this kind of approach, it really puts the burden of the impact of this pandemic on the same populations that have been hit the hardest so far.
And a reminder, we just mentioned it before the break. We've got 8 million more Americans living in poverty. That means they are more compromised in terms of their living situation and being susceptible to getting this. I do want to ask you about the Midwest, because we are seeing cases surge there, and the president is holding mega rallies in those very states. Give us a reality check on where we're headed.
Yeah, early on, we were seeing big case numbers on the coasts, and then we saw it in the South. And the Midwest, it seemed, was somewhat protected. And now we're seeing the Midwest seeing high numbers. We're seeing increasing numbers and record numbers in rural America. There are a number of reasons for this. One is that the virus doesn't care where you live. It doesn't affect every place at the same time, but it will affect every community. The other aspect is, and this is something we've been talking about since this started, is that as weather gets colder, the virus does better. Viruses last longer. They hang in the air longer when it's cold and when humidity is low. And then as the weather gets colder, we're spending more time indoors. And those are all things that favor transmission. So during this time, you really need to double down on social distancing, on wearing masks, of not having big indoor gatherings. Those are things that can lead to spread of virus. And we have to increase our attention to these details at a time when the virus is by nature going to do better.
In just the past few days, both Eli Lilly and Johnson & Johnson have paused their vaccine trials. What's your take?
Well, this is something you expect. And it's really important people keep in mind that these are trials. There is no proof yet that these vaccines will be safe and effective. And you want to see that there is monitoring being done so that if there is something of potential concern, there's a pause on the trial. The monitoring committee, there are independent committees that monitor these trials. Will take a look at this. It may turn out that the problem has absolutely nothing to do with the vaccine, but they have to stop and look. They'll see, well, did the person or persons who have the problem, did they get the vaccine or did they get the placebo? If they got the vaccine, well, was what happened potentially related, or was it just somebody who had another life event? With tens of thousands of people in vaccine trials, other things are going to happen in their lives. There will be people who have heart attacks or people who develop cancer. And you have to look to see, well, was it related or is it just coincidental? But it raises the point to me that we can't count on there being a vaccine. I'm optimistic that there will be one. But until there is one, until we know that it's safe and effective, and until one's distributed, we have to do all these things that public health is saying, or we're going to lose tens of thousands of lives, and those deaths could have been prevented.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.